Hi, I'm L'Oreal, and this is going to be my IV insertion and discontinuing video. So to begin, we're going to make sure we have our right identification, make sure that we have our right nightingale attire, and we can begin. So we are going to go ahead and check our provider's orders. It says we're going to be administering a blood transfusion later on. So we're going to make sure we have the right patient, the right procedure. We have any allergies? None. Okay, great. Is there any other contraindications that alert us to alert our provider? So far, everything checks out. So we're going to go ahead and grab our supplies. Our supplies are going to be our hand sanitizer. This will be using for my IV Sharps container, my Bio Sharps container. I have my gloves, a pen, an IV kit. We're going to have a normal saline syringe. We're going to do a 20 gauge IV catheter set today with an extension. And we're going to have our arm, our patient's arm. So we're going to begin by going ahead and knocking on a patient's door. Knock, knock. Okay, come in. Great. I'm going to go ahead and close that door behind me for privacy. I'm going to perform my hand hygiene. So I'm going to say, hi, I'm L'Oreal. I'll be one of your nurses today. Is it okay if you go ahead and verify your name and date of birth for me? I'm checking the wristband. He says Monty Potter, October 14th, 1972. All right, great, Mr. Potter. So today we are going to be going ahead and administering that blood transfusion. So in order to do that, I do have to insert an IV on your forearm. Is that okay with you? Yes? Okay, great. I just wanted to explain to you that this might take around 10 minutes. We will be inserting it on your forearm. And if you have any questions or there's anything that comes up, you let me know, okay? Okay, great. So it's important that when we're looking for a location to insert this IV, that we're looking and making sure that there's no bruising, tenderness, swelling, or redness already. So we found our place. It looks good. So we're going to go ahead and begin preparing our materials. Alright. Our trash is right here to the side, so I'm just going to throw everything that we don't need it that would make this cluttered or mess. We are going to go ahead and prime our tubing. So it's really important when you're priming your tubing, you're doing this to make sure you don't have any air in the line. So if you get a little bleb of water at the top, that's perfectly fine. We just want to make sure that we're really not inserting any air into this vein once we get the IV set. We'll set that to the side. So we're going to go ahead and get our tourniquet. I'm just going to get this tape ready really quick before we start doing all that. And we'll open our IV set. All right, so when we go ahead and place our tourniquet, it's going to be 4 to 6 inches where we're going to insert. So when we tie it around the 4 to 6 inches above where we're going to insert, we're going to do a quick release tie. We want to make sure that it's tight enough to get a good look at this vein, make sure it's palpated and everything's going good. But we don't want it to be too tight where we cannot palpate a distal pulse. So we're going to go ahead and check that distal pulse now. And it looks good, it feels good. Great. So what I'm going to do now is go ahead and grab my alcohol swab that comes in the kit. And since it's an alcohol swab, we're going to be going in a circular motion from inward to outward. If it were a CHG, we would be going back and forth for at least 30 seconds. But with the alcohol swab, we're going to go inwards, outwards with the alcohol swab. All right. We're going to allow that to completely dry. While we grab our needle. So with the needle, what's important with the needle is that when we're grabbing the needle, we want to make sure that the bevel is up. In this case, it makes it a little bit easier. We do see the white piece where the bevel's at, so we want to make sure that we have that. So Once this is completely dried, we're gonna hold 1 or 2 inches below where we're gonna insert. We're gonna hold it taut. We're gonna hold it taut. We're gonna insert at a 30 to 45 degree angle. Once we get a flash of blood in our chamber, we're gonna go ahead and level out. Insert that at least a 1/4 inch more, just to make sure the catheter is really in there. Keeping the skin taut, we're gonna go ahead and insert that catheter while simultaneously pulling out that needle. We're gonna hit our release and we're gonna go ahead and place it in the sharps container. With my non-dominant hand, I'm gonna hold that catheter in there while quickly attaching my extension set to my hub. We're gonna release our tourniquet and we are going to aspirate for blood. Once I see blood in the tubing, I'm gonna go ahead and flush. Make sure that there's no type of swelling, any discoloration, any pain for that patient, no bubbling. Once that looks good, I'm gonna go ahead and lock the tubing. And we are gonna get our transparent film dressing. And you wanna make sure that you're holding onto that IV so that we don't lose access. Holding onto that IV, well, we're gonna tape this to make sure that the lure lock is still exposed, but that we can still see the tip of the catheter perfectly fine while holding it in place. So we'll go ahead and peel all of this excess off. Okay, now that it's secure, I'm gonna go ahead and release the saline lock. We are gonna go ahead and loop this tubing to the side and tape it down. Was that painful for you? It's okay? Okay, great. All right, so we're gonna go ahead and get our label right here. So with this, we're gonna put our initials, the time of the insertion, the date of the insertion, and the IV gauge and length. All right, we're gonna go ahead and place that up here. And we will go ahead, get all of our trash out of the way. Make sure our sharp is in our sharps container. That looks good. And all right, Mr. Potter, if you have any questions, you go ahead and press that call it and I will be back to help you. If not, I'm gonna go ahead and take off my gloves, perform my hand hygiene, and I'm going to leave the room, document how well he tolerated the IV insertion, what gauge it was, how many attempts it took, if there was any reaction. So now for the discontinuing the IV portion, we are gonna go ahead and make sure that we have all of our supplies. We have our provider's orders. Again, it is the right patient, it is the right procedure. We make sure we have our supplies for this one. So it's gonna be at least 2 pieces of gauze, tape, gloves. We have our hand sanitizer and our straps container once again. Our patient is already set up, so we are going to go ahead and knock on the door. He lets us in. We go in, we close the door for privacy. Good morning, Mr. Potter. Today we will be verifying your name and birthday, so if I can verify your name and birthday. Monty Potter, October 14th, 1972. Great. Okay, so right now your provider has ordered that we don't need this blood transfusion or this line anymore. So we're gonna go ahead and discontinue your IV. Is that okay with you? Great, okay. It should take about maybe 5 minutes. We're just gonna remove the dressing, stop any bleeding if there is any, apply a new dressing, and then you'll be good to go. Okay, so we're gonna perform our hand hygiene. We're gonna put our gloves on. And again, we have our supplies. All right, so we're gonna check our line. Everything looks good. So we are going to go ahead and start peeling back this tape. We're going to secure this IV. Make sure that it doesn't come flying out at us. So tell me if there's any pain or any questions that you have during, okay? Okay, great. All right, all of our tape is off. So we are going to secure this and grab our first piece of gauze. We're going to go ahead and hold the gauze over the IV site while we slowly pull out the IV catheter. We're going to apply pressure while we place this into the sharps container. So we're going to apply pressure for at least 30 seconds, but until the bleeding stops, but for a minimum of 30 seconds. So we go ahead, we leave it on there for maybe 45 seconds until the bleeding has completely stopped. At this point in time, we can grab our new sterile dressing. And we are going to remove our old one and we're going to place our new. Once we place that there, we're going to go ahead and grab our tape. And place it firmly over. Before we do that, we're going to go ahead and check our tubing and our length. We want to make sure that there's no kinks, the integrity is good, and that we're not missing any pieces or anything that we should look out for. Since it did look good, we went ahead and taped it and put the gauze. Other than that, Mr. Potter, did you need anything else today? No? Okay, great. Sounds good. Let me know if you need anything, okay? We're going to make sure all of our trash is out of the way and the straps are appropriately placed in the straps container before removing our gloves and performing our hand hygiene. Thank you.